Hello, class. Today we're going to go over the disease norovirus, or NOV for short. So, as you can see in this photo, NOV is a round virus, an undeveloped positive single strand RNA virus, and it's a member of the Calciviridae family. And the five genera of that family includes norovirus, along with four other genera: Vesivirus, Lagovirus, Sapovirus, Nebovirus, and Norovirus. There are six genogroups of norovirus, but only three infect humans. Those are genogroup 1, 2, and 4. The other genogroups mostly affect rats, mice, cattle, and other animals. This infectious agent causes gastroenteritis, which is defined as inflammation of the stomach and the intestines. And this is what causes the vomit and diarrhea that you see in the symptoms of this disease. So, common names. The first common name that many people cite is called the cruise ship virus. And this is not because this disease only occurs on cruise ships. For outbreaks, only 1% of outbreaks are on cruise ships, the rest are off of cruise ships. So we're really looking at what is the majority cause of diarrheal disease on the cruise ships, and that is norovirus. About over 90% of diarrheal diseases on cruise ships are from norovirus. And this is caused from close conditions and compact spaces. So, like dining areas on cruise ships and rooms are really close together. And the fact that it's resistant to a lot of disinfectants, which makes it hard to keep off of surfaces. And the reason these outbreaks happen is mostly because of contaminated water or food that people can bring on board, or just the presence of it in the environment of the cruise ship. The other common name that people ascribe to NOV is Norwalk-like viruses, which comes from the fact that it was identified through electron microscopy in 1972 from a 1968 outbreak in Norwalk, Ohio. The last common name for norovirus is going to be called stomach flu or stomach bug. And this does not mean that norovirus is an influenza. It's not an influenza and should be distinguished from that disease. So the symptoms include, of course, the hallmark ones are vomiting and diarrhea. Diarrhea is usually non-bloody and watery. Other symptoms include abdominal and stomach cramps, myalgia, which is defined as muscle pain, and malaise, general feeling of tired uneasiness, and headaches. Low-grade fever is uncommon but can still happen. And if these don't get treated, severe complications include dehydration. The incubation period's usually from a half a day to 2 days, although symptoms last about 1 day to, I guess, almost 4 days, yeah. And this means that the virus can be spread through both asymptomatic transmission and through having the symptoms, which shows that 30% of infections are asymptomatic. So it's very easy to spread even if you don't feel that you have the disease. Long-term sequelae associated with this is usually irritable bowel syndrome, which you can tell from the fact that gastroenteritis targets the stomach and the intestines. So it messes up your bowels and causes this disease over time. So transmission, this is a highly contagious disease. Billions of particles are shed by people when they have this disease, but it only takes about 18 to infect you. So that means that it can affect a lot of people during an outbreak. The way it's transmitted is through fecal-oral route, meaning that feces usually enter the mouth, or from droplets from vomit. And as we talked about before, the three genogroups that infect humans, that means that the human reservoir applies to genotype 1, 2, and 4. The three general ways that norovirus will spread is through food contamination. So if you remember, Amy talked about the botulism disease and about how it spread through food contamination. Likewise, norovirus also spreads through food contamination, but this time through feces, particles of vomit or feces, and also contaminated water. So if contaminated water is used in the production of a food, so CDC gives the example of oysters. So oysters can be, if you don't steam them and kill the virus, then you can get norovirus from the oysters or fruits if they use contaminated water to grow it. It also spreads through water contamination, kind of like how cholera spreads through water. Norovirus also spreads through water, mainly untreated water or water with vomit or feces. Also spreads through surfaces, as we talked about before on the cruise ships, very very resistant to disinfectants. Therefore, you see a lot of it can be from food, contaminated food being on surfaces, could be directly from feces, whether it's vomit or diarrhea. So it transmits through the surfaces, water, and food, which means that it can be spread fairly easily, which we'll talk about when we talk about incidence and prevalence of norovirus. So, where do outbreaks occur? As we talked about before, cruise ships are an example of confined spaces where the population's more dense is going to spread quickly, especially when we talked about the particle shed of norovirus. And also institutional settings. So, we're talking about schools, daycares, places where, again, people are close together and where maybe there isn't the most hygiene. And if we look at norovirus and how it impacts the world, we're looking at about 20% of gastroenteritis cases are caused by norovirus. So that's actually a big chunk of the cases that affect vomiting and diarrhea around the world. 685 million cases of gastroenteritis are linked to norovirus, which is a huge number, and that is larger than the entire population of the U.S. around the world. People suffering from norovirus. This is especially a problem in poorer countries because they do not have as much access to sanitized water and water that's safe to drink. So we see a big problem with childhood deaths in lower income countries, with about 50,000 deaths every year from norovirus. And this is related kind of to Dory's presentation on rotavirus and how it causes a lot of diarrheal disease in poor parts of the world and kills a lot of people. This disease usually happens around the winter months, so I guess around December to February. I think it might be January, maybe, that it starts in, but it's very centered in the winter season. So, last thing I want to talk about is prevention, treatment, and diagnosis. So the prevention for this is to wash your hands pretty much. Basic sanitation, warm soapy water for 20 seconds. Many people do not wash their hands for the entire 20 seconds. So a good way to make sure that you are washing your hands long enough is A Chorus of Africa by Toto. Lasts about 20 seconds, and it makes sure that you aren't bored washing your hands. Next thing you need to do is clean surfaces very well, usually through bleach solution, I guess. You want to steam your food, cook your food, because it can spread through food contamination. And the difficult part of this is, Dory talked about how there's rotavirus vaccines. There is no vaccine for norovirus. So, and this is because the capsid evolves over time, which makes it harder to treat the disease. And then if we're looking at treatment, what you want to do is drink plenty of fluids. This, again, if we're going back to the previous discussions on diarrheal disease, this is much more complicated in lower income countries where they do not have access to clean water and food. So it's going to be much harder in those countries. And IV fluids are mainly for the complications with norovirus, which is dehydration, which causes the deaths from this diarrheal disease. And of course, washing your hands to prevent spread. This is very important because you stay with the disease. You exhibit symptoms for almost 4 days. So what that means is that you are going to be spreading it when you touch things. So you want to make sure that when you're sick, you wash your hands so you prevent the spread. Again, highly contagious disease. Only 18 particles needed to get another person sick. So it's very important when you're sick to wash your hands. And then to get tested for it, you would need an RT-PCR test, and that detects the nucleic acid presence of the RNA virus that's in your system. These are my works cited for this presentation. Thank you, and I look forward to your questions on Monday.